Imagine a world where happiness and sorrow both lie in a small pill, a puff, or a sip. Have you ever wondered how a habit turns into an addiction? Are you curious to know what the signs are, how it begins, and what its consequences could be? If yes, then you're in the right place. Today we will talk about a problem that is not only spreading in our society, but is also breaking many homes. Yes, today our topic is substance use disorders. So let's learn about it in depth. Let's take a look at its main points. First, we will see what it is, how many types are there, what are its symptoms, what causes it, how can it be prevented, how is it diagnosed, how can it be treated, and finally, its conclusion. So let's start from its first points. What is this substance use disorder? Substance use disorders is a type of mental illness where you start consuming more of an intoxicating substance, such as alcohol, drugs, tobacco. It can heavily impact your daily life, health, and social relationships. In this condition, it becomes difficult for you to live without that substance, regardless of how negative the outcomes may be. Now let's move forward and see how many types it has. So let's start. Substance use disorder essentially comes in two types. First, physical dependence. Here, you feel that if you don't consume drugs, your body won't function properly. What used to feel normal before starting to use substances now feels odd without it. It's similar to how some people feel the need for tea or coffee upon waking up. But here, we are talking about more serious stuff like alcohol, drugs, etc. Second, psychological dependence. In this type, you feel that if you don't consume substances, you won't be able to function mentally, meaning your mind won't work properly. You think that using substances is necessary to reduce stress or to feel good. This involves more of a mind game, less of the body. These were the two important types. Now let's move on to the next point. Understand the symptoms of substance use disorders in very simple language. So let's start with the insistence on using substances. When a person keeps using substances repeatedly, non-stop, regardless of any problems it may cause. Next, weak control. Unable to resist the desire to use substances, like thinking to reduce usage but unable to stop. Next, excessive time in substance use. Spending a lot of time in using substances, preparing for it, or coming down from its effects. Next, failed attempts to quit. If someone decides to quit but fails to do so despite multiple attempts. Next, problems in relationships. Relationships with family, friends, or colleagues deteriorate because substance use becomes more important. Next, neglecting responsibilities. Impact on school, college, or job because substance use takes priority. Next, self-harm. Continuing to use substances despite knowing it's negatively affecting health, mood, or life. Next, tolerance. The same amount doesn't have the same effect anymore, needing more of the substance. Next, withdrawal symptoms. Experiencing physical reactions like shaking, restlessness, or feeling bad when not using substances. These symptoms indicate that someone might have a substance use disorder. If you or someone you know displays these symptoms, it's a sign that help is needed. If you notice any other common symptoms, feel free to mention them in the comment box. Now, let's move on to the next point, where we will learn about the causes of its occurrence. There are some common reasons for the development of a substance use disorder, which I'll explain to you in a very simple way. So let's start with stress or tension. Sometimes life's stresses or troubles are so overwhelming that people think substances will give them relief. The difficulties at school, office, or home seem so insurmountable that substances appear to be an escape route. Next, friends or family members. Sometimes, if family members or friends use substances, it seems normal, as if everyone is doing it. Then what? You start trying, and gradually it becomes a habit. Next, childhood difficulties. Sometimes, the difficulties faced in childhood, like family problems or issues at school, have such a deep impact that people start using substances to escape that pain when they grow up. Next, mental health issues. Sometimes people turn to substances when their mental health is not good. Substances seem like a temporary solution to cope with issues like depression or anxiety. Next, curiosity or experimentation, especially in youth. In the search for new experiences, people try substances. Initially, it's just for fun, but gradually this fun turns into an addiction. Next, to feel better about oneself. Sometimes people think that substances make them more confident or forget their problems, so they turn to them. Next, these are just some of the reasons. Every individual's story is different. Substance use disorder is a complicated issue. These were some reasons. If you feel anything is missing or have your strategies to share, please let us know and share this video with your friends, family, and colleagues so that with your help, we can assist all those in need. Now let's move to the next point where we will see how it can be prevented. So let's start with choosing the right friends. Stay with friends who do not use substances. A good circle keeps you away from substances. Next, reduce stress. Reduce stress by doing yoga or meditation or spending time on your hobbies. Next, treat mental issues. If there are any mental issues, talk to a doctor. It can reduce the inclination towards substance use. Next, be informed. Know how substances can harm you. Understanding this can help you stay away. Next, try to stay happy. Keep yourself engaged in positive activities so you don't even think about substances. Next, seek help. If you feel drawn to substances, seek support. Talk to a doctor or a support group. Friends, these are some important tips by following which you can protect yourself or your loved ones from substance abuse and live a happy life. If you think anything is missing or have any point or suggestion to add, please let us know in the comment box. Also, share your strategies and share this video with your friends, family, colleagues, and loved ones so we can help them. Now let's move to the next point, where we will learn how it is diagnosed or examined. Let's understand how the diagnosis or examination of substance use disorders is conducted in a simple way. Starting with the conversation or interview, the first step involves talking to a doctor or mental health professional. They ask the individual about their habits, the amount of substance use, and its impact on their life. Next, physical checkup. Doctors also perform a physical examination to see the effects of substance use on the body. Next, blood test and urine test. Sometimes blood or urine tests are conducted to find out if the individual has recently used any substances. Next, psychological evaluation. This is to determine if there are any mental health issues that are exacerbating the habit of substance use. Next, taking a detailed history. Doctors or counselors also want to know the person's personal history, like if anyone in the family has a history of substance use, or if there has been a previous injury that might be contributing to the habit. Combining all these methods, the doctor or mental health professional decides whether the person truly has a substance use disorder, and if so, how severe it is. So, friends, these were some of the diagnostic methods that help in identifying substance use disorders. Now let's move to the most important point, where we will see how it can be treated. Treating substance use disorders is possible and can be done in several ways. Let's understand this in very simple language. Let's start with detoxification. First, the substances need to be removed from the body. This process, known as detox, involves gradually reducing and then stopping the intake of the addictive substance under medical supervision to allow the body to adjust. Next, counseling and therapy. Individuals discuss their problems with a therapist or counselor. This helps them understand why they started using substances and how they can overcome the addiction. Next, support groups. Groups like Alcoholics Anonymous, AA, or Narcotics Anonymous, NA, provide support to those trying to quit. Members share their experiences and support each other. Next, medications. In some cases, doctors prescribe medications to reduce cravings or manage withdrawal symptoms. Next, behavioral therapies, such as cognitive behavioral therapy, CBT, where individuals are trained to think and behave in new ways to avoid substance use. Next, family therapy. Sometimes, therapy involves the entire family to help family members understand how their support can assist the individual. Next, rehabilitation programs. In severe cases, individuals may need to stay in a rehab center where they receive round-the-clock care and support. Remember, every individual is different, so the treatment is tailored to the individual's needs. The journey to quitting substances is challenging, but with the right help and support, it is possible to overcome this hurdle. Now, let's conclusion. Substance use disorder is a serious issue that significantly impacts an individual's life and their family. However, it's important to remember that it is treatable. With the right help and support, an individual can overcome this addiction and lead a healthy and prosperous life. This was our video for today, in which we explored what substance use disorder is, how many types there are, what its symptoms are, why it occurs, how it can be prevented, how it is diagnosed, and finally, how it can be treated. I hope you found this video helpful. If you liked our video, please share it with your friends, family, or colleagues so we can help others. See you in the next video with treatment options for another disease. Until then, a big thank you, and don't forget to like, comment, and share. Thank you.